I was actually diagnosed on a day that I wasn't expecting to get bad news. I had a surgery and they actually took out a tumor that was about this big.
She had been diagnosed with a fairly rare cancer, and a cancer that is notoriously difficult to treat if it does come back.
I found it particularly true for me with a rare cancer was that there isn't a standard of care. The question remained, what tools do we have to treat this microscopic cancer that's floating around in my peritoneal fluid? And so HIPEC seemed like the really only remaining tool in our arsenal.
HIPEC means hyperthermic intraperitoneal chemotherapy. The HIPEC procedure is essentially two steps. One is cytoreduction, which essentially means that we do an extensive abdominal operation to remove all visible tumor. Once that happens, then we insert tubing equipment that allows us to perfuse the abdomen with the heated chemotherapy. During that time, the abdomen is agitated enough so that the chemotherapy tries to penetrate all the different areas of the abdominal cavity and treat the surface. Shay's procedure went very well. We were able to find very minimal tumor in her abdominal cavity, which was easily removed.
So I was sitting in my hospital bed and Dr. Lee looked into the system and he looked up at me and said, "Your cytology came back, no evidence of disease." HIPEC was a lot easier for me to recover from than going through 6 rounds of chemotherapy. I would pick HIPEC over chemotherapy any day.